You're watching Utah's #1 news channel. This is 2 News at 4.
He survived 18 heart attacks in just 10 years. Now West Jordan man is called a walking miracle. Thanks for joining us here on 2 News at 4. As a result, he underwent both a heart and liver transplant at the same time.
Dan Rascone spoke to the patient and doctors today. He joins us live from Intermountain Medical Center in Murray. Dan, do doctors know what the problem was with this patient?
Yeah, Christine and Heidi, according to doctors, Mike Mader was born with a genetic disorder where he was missing a gene in his liver that helped process cholesterol, which basically means he had very, very high cholesterol when he was born. His mom says it was in the high 400s as a youth. That later led to one heart attack after the other.
It's been a night and day difference.
31-year-old Mike Mader, seated in the middle of a team of doctors, doesn't look like an organ transplant patient.
He looks terrific.
Mike is actually recovering from not only a heart transplant, but also a liver transplant. Both surgeries done on the same day, one right after the other, here at Intermountain Medical Center in Murray. The difference for Mike now?
Energy, most of all, just not being short of breath and sleeping better. I mean, I could go on for hours about all the little differences.
Mike is the first adult combined heart and liver transplant to be performed in the Intermountain West.
We have a young man sitting here who has had the gift of 2 organs from some family that was kind enough to give that gift of life to this young man.
Mike was born without a gene that keeps the cholesterol level under control. So at the age of 3, his mom says his cholesterol was 476. His first heart attack was at the age of 22.
Yeah, very freaky. Big surprise. I didn't think I would have one that young. I was always kind of told it might be like in my 40s or 50s due to the severity of the condition.
Mike would go on to have another 17 heart attacks during that nearly 10-year span until the transplant surgery. Doctors say he's very lucky to have made it that far.
Many patients like him will not make it to be an adult. Often they will die at a young age.
The double transplant surgery happened on April 23rd. Mike was released from the hospital on May 6th. He's now anxious to move forward with his life.
Just being able to meet my goals and kind of just be a normal person for once, so I'm pretty excited about that.
Now, Mike waited 718 days for those organ transplants. Now, he still has to be watched very closely. Doctors say during that first year of recovery, very high risk of rejection, especially during the first 6 months. So he has to continue to get checkups every 2 weeks here for a little while. Now, his family has set up on a donation account there, Wells Fargo, for those interested in wanting to help out with surgery expenses. But it's amazing to see this young man, how well he's doing considering how many heart attacks he's had. Christina, Heidi, back to you.
Very amazing. We wish Mike the best. Dan, thanks a lot.
In other